the background on, so it kind of blurs things. But this is the advanced hair system here, right? Inside each of these boxes, there are 6 of these vials like this, okay? So what you're going to do is you're going to disinfect the scalp with 0.5% chlorhexidine. I'd encourage you to recommend that you get your clients to the morning of the treatment to make sure they give them the scalp a nice clean shampoo using a nice cleansing shampoo. And then they come in, make sure they don't have any product or anything in their hair. So they come in, and then all you'll then do is you'll disinfect the scalp with 0.5% chlorhexidine. You can then use any kind of needling device that you guys have in your clinic, in your practice, dermapen, skin pen, anything like that. And then you're going to needle the treatment area at a depth that ranges anywhere from 0.5 to 2 mm. Some of you in here might want to go a little bit deeper. Honestly, my recommendation in terms of the depth is about 0.8 to 1.2. That's about the depth that you go at. If you've got an adjustable needling tool, start at 0.5 and then work your way up to that 0.8, 1.2 range. What you'll then do is you'll see here the vial. It's kind of like a glass casing, and then it's got like a kind of silicone tip to it. Now, if I turn it upside down, nothing falls out, but then I give it a squeeze and it falls out. What you're then going to do is once you've needled that treatment area, same like you would with microneedling, you do 2 to 3 passes. You'll then apply half of the vial along that treatment area, and you'll just squeeze it out and lightly rub it in as you go. What you'll do then is you'll needle the treatment area once more, apply the remaining half of the vial. You then do a nice little massage afterwards, and then you tell the patient to not wash their hair for 24 hours afterwards. They then come back in and do this with you in the clinic once every week for 6 to 12 weeks. So you disinfect the scalp, needle the treatment area, apply half the vial, needle the treatment area again, apply the remaining half of the vial, massage the scalp for 3 to 4 minutes, and then tell the patient to not wash their hair for 24 hours. And they come back in and they do that with you once per week for 6 to 12 weeks. Now, you can do a variety of other different components with this. You can combine this with other therapies. You could add in a little bit of red light therapy afterwards, where if you want to exaggerate the results, I think a nice little 20 to 30 minute blitz afterwards would be good to exaggerate the results from there. Now, in terms of downtime, there's no real downtime that comes with this. You apply this, you give it 24 hours for it to go into the scalp, then you can wash your hair and you're good to go. They're going to come back in and do it with you once per week for 6 to 12 weeks. Remember again what PTT6 is doing. It accelerates that recovery time, but it also exaggerates the results as well. So there's no need to worry about downtime or anything like that comes with this. Once you've then done that for 6 to 12 weeks, you will then move on to maintenance. Now, maintenance, you can do it a variety of ways. You could either do it where you have them come back in and visit you once per month to have a top up. Alternatively, you could have them come back every 3 months and you just review with them. What you could also do if you wanted to really get them onto it and keep them on it, and a lot of our successful clients do this, is that they basically sell them the box afterwards, another box, and then they sell them the box with their own dermostamp device. And what they would basically do is they would, at the end of the 6 to 12 weeks, they would then say, okay, cool, you're going to take this home with you along with your own dermostamp device. I'm going to show you how you do it. They then go home and do it for 3 months using half a vial once per week. So that's going to go for 12 weeks or 3 months. They then come back in and visit you. So you book in that follow-up appointment 3 months after you sent them away. And then you do a review with them. A common thing that people will often ask me is they'll often ask me, well, what happens if you stop using this product? And it's like I said earlier, what happens if you stop going to the gym? What happens if you stop brushing your teeth? This product is not treating the cause of hair loss. It cannot treat a hormonal imbalance. It cannot treat a hereditary predisposition to hair loss or hair thinning. It cannot treat a stress-related hair loss. If you do a hair transplant, you don't do a hair transplant and leave it forever. You need to maintain the results. So what you need to do is you need to do a 6 to 12 week treatment program, followed by 3 months of maintenance. And then from there, they review, you and them review together once every 3 months or once every 6 months if you would like. Now, it might be that they come in and they go, I want to keep going because I'm really happy with the results and I want to keep them. It might be that they say, I want to leave it for 2 or 3 months because I want to just see what happens. They come back in 2 or 3 months later when you go, okay, cool, we're seeing it regress a little bit. Let's get it back and we can move you back onto maintenance or we could do another treatment. But it's an ongoing journey. It's anti-aging for our hair, basically, right? There's no treatment that you can do anywhere in the world that will be able to actually physically prevent hair loss from happening for the rest of your life. That is next to impossible because that is basically the elixir of life that you're trying to find. It's the same with skincare, right? You can't use skincare for 6 weeks and be like, I'm good now, right? You need to keep it healthy and keep it active, and that's what the advanced hair system does, is it keeps it in that youthful state. One of the other options that you guys can look at as well is you could look at the idea of where you do the first and last application in the clinic. If people maybe don't want to spend the same amount of money, you could have options. You can have different tiers and packages where you could have them come in every week, which is what most of our clients do around the world. Or you could just do the first and last one for them, and then in between, they do it themselves at home, exactly like I just said, where they do half a vial twice per week instead of once per week. And then they come back in and you do the last one for them at week 6 or week 12. It depends how you want to offer it. There's a variety of ways, and the Neo Asian team will be able to kind of guide you on what is best recommended, whether you do weekly in clinic or you do the first and last one. The reason why most people go with this option of doing it every week in the clinic is because you have more control. There's less room for error. The clients aren't going to go off and forget about it. So it gives you a bit more control, but there's options that you guys have here basically. Now, you've heard me say a few times 6 to 12 weeks. By the way, I can see those questions are still coming in, guys, so keep them coming. I'm gonna get to them when we get towards the end here. So you've heard me say 6 to 12 weeks. A 6 week program is one box. A 12 week program is two boxes. Okay, so a 6 week program, we've got the Norwood scale for men, and then we've got the Ludwig scale for women. The Norwood scale is basically going to tell us whether we do a 6 or 12 week program, whether we're in that 1 to 5 range. So 6 weeks is going to be 1 and 2, and 12 weeks is going to be 3 to 5. So if you have anybody in that 3 to 5 range, and a lot of you, I reckon, have come to this call with maybe a person in mind that you want to use this on, and they're probably in that level 3 to 5 range or type 2 for women. You want to be doing a 12 week program. That's the recommended guideline because the hair has been asleep for a while. It needs time to wake up. There is, however, a point of no return. There is a point at which the product will not be suitable for them, where the hair loss is too far gone. Essentially, that's when the hair follicle is dead. Once it's been asleep for too long, the follicle fuses and therefore is dead. We can't bring a follicle back to life. We can wake it up, but we can't bring it back to life. That being said, could you use it on a 6 or a 7, and could you have some level of improvement? Yeah, potentially you could. Around the fringes, you might be able to, around the edges where there is active hair follicles. But in reality, it's just what is the goal? What are we trying to achieve here? So these are the scales that we use for both men and for women. These are just the options that we spoke about. You could either do the advanced service where they come back in every week. We've already spoken about this, so don't worry. I know it's a lot of text for you to read. It's quite hectic. The professional service is where you do the first and last one in the clinic, and the DIY service is that kind of they can do it themselves at home as well. Last thing before I just flick through to the before and afters and show you the results, because I'm sure you're all wanting to look at these results, is just talking a little bit about how you run that consultation. You need to make sure that you understand exactly what is going on with them. Have they tried any hair loss treatment programs before? How long have they been suffering from hair loss? Make sure you get all of the relevant information needed from them. If they are suffering from hair loss under the age of 30, I do oftentimes say just immediately go straight onto the 12 week program, mainly because it's just if they're under the age of 30, they've probably got built-in hereditary conditions that cause their hair loss, and it means they're a little bit more severe. If they've been suffering for hair loss for over a year, you can also get them straight onto doing that as well, that 12 week program. And if they've tried any other kind of programs like minoxidil finasteride without any effect, then you can move straight onto 12 weeks as well. Step 2, take a picture of the hair. You guys are obviously very well versed in doing this in your practices, but make sure you take a picture of the hair. You can take a picture of the hair for a few reasons, but the main reason is there's a lot of the services that you guys offer are what you would maybe describe as instant gratification, whereby people come in, they do a microneedling service, and then 2, 3 days later they can see the results and they're really happy with it. They do a CO2, a few days of downtime, they see the results, they're really happy with it. With this, it takes time. Hair takes time to grow. With a hair transplant, you don't really see the results of the hair transplant for about 4, 5, 6 months because you've got to wait for it to all come through. With here, you do need to take a little bit of time with it. And taking a photo allows you the ability to kind of be like, this is the starting point. And then when they come back in at week 3 and week 4 and week 5, you can take another picture and you can be like, look, we're seeing the quality of the hair is improving, the scalp health is improving. Many of you will have trichoscope devices that you can use to actually assess the scalp health overall, and you can be a little bit more quantitative and objective with the results. If you've got those tools, excellent. Get them scanned, get them set up, understand what their scalp setting is, and then work from there. You can use it as well as part of the consultation. You take a photo, show them the picture, kind of agree whether you want to do a 6 or 12-week program, depending on that. And then once you've agreed to do a 6 or 12-week program, then you can agree what kind of service you want to offer, whether you want to do it weekly or whether they're going to do the first and last one in the clinic. Set those expectations really, really early. Make sure it's very clear for them that they need to know that the hair is not just going to wake up on week 2 or 3 and they're going to have long, wavy hair. It's going to take time. It's going to take time to see those results. So the first thing that we need to say to them is wait till the end of the treatment phase before we expect to see any results. The second thing we want to look at then is, well, what type of results should we be expecting? So we want to see an improvement in scalp health. We want to see an improvement in the quality of the hair. And then we'll see some new baby hair follicles sprouting through. That actually may happen at week kind of 7, 8, 9 when you're in maintenance. So we do basically just want to say at the end of the treatment phase, what is the purpose? The purpose is to get the wheels in motion. It's to reintroduce the members of the orchestra and get them used to all working with each other again before it's that beautiful symphony and brings it back to the way it was when we were younger. And then last thing, maintenance. One of the most important things is maintenance with this and communication of what maintenance is. You know, people need to realize it's not going to be you do 12 weeks followed by one round of maintenance and you're done. You do need to assess and have this ongoing journey that goes with that. So you do need to be on top of that and just keep maintaining and checking in with them as you go through. So let's just quickly go through some before and afters, and then I'll answer some questions. I haven't looked at some of the questions yet, but one often common question that I do get asked is, does this product work for X type of hair loss? I.e., does it work for alopecia areata? Does it work for androgenic alopecia? Does it work for telogen effluvium? Does it work for trichotillomania? Yes, is the answer. It works for every single type of hair loss except 3 instances. There are only 3 instances where you do not use this product. The first instance where you do not use this product is anybody that is going through active cancer treatment. The reason for that is purely because the cancer treatment, the chemotherapy, the radiation therapy, it kills the product. So you could apply the product and then once you go for chemo, it will just kill it. So therefore we don't use it. Obviously, if you're going through cancer treatment anyway, focus on that. Once we're in remission, you can use this product 100%. Once the doctor says, okay, you're cancer free, you're in remission, you're good to go, you can absolutely use this product to help accelerate the hair regrowth as it comes back through and improve the quality as it comes back. The second instance where you can use this product is you can't use this product, is what is called scarring alopecia. And scarring alopecia is basically where, for those of you that don't know, is just when you're young, you fall off a bike, you cut your head and it's got a scar. Hair can't grow through that scar. It's gone, it's dead. So therefore we cannot use that. And then the third instance is just hair loss that is too far gone. And that hair loss that is too far gone is the scale that I showed you earlier, that Norwood and Ludwig scale. So then these are just some more before and afters in here. I'm just going to kind of slowly go through these. And as I go through them, I'd like you to be thinking think of not just the results in terms of hair loss treatment, Also think about the results in terms of the quality of the hair as well. Notice how the hair is thicker, it's fuller, it's healthier. So we're bringing hair back to the way it was when we were younger, which is therefore going to bring that kind of healthier, younger looking hair overall. Do you guys remember at the beginning I mentioned about how the doctor in the UK started everything off for us? She did her own trial on her husband. Those images on the bottom right, down at the bottom three, is were the images that we got. So we did the before, which is on the left, and then the middle picture was what we got at the end of 12 weeks, and we were like, wow, that looks amazing. And then he continued doing it for another 3 months. So the images from left to right are before 12 weeks of treatment, and then the far right is actually after 3 months of maintenance. That's 6 months after the before. Top left, you can see an interesting result there because the result actually is demonstrating an improvement in the hair color as well. Now, with hair color, it's interesting. We don't necessarily actually have an exact justification or reasoning for why it happens, but I can tell you anecdotally, in about 20 to 30% of cases that clients using this product, they do notice that the color of their hair starts to come back as well. What that is pinned down to, I cannot tell you. I can't tell you if it's a specific hair loss type that is receptive to it. I can't tell you if it's a specific peptide growth factor that does it. We just know that in some instances it does seem to help to bring back your natural hair color as well. And then again, some more before and afters in here to help demonstrate the results on different hair types as well, which is awesome. Cool. Now, I said at the beginning that, well, before we got started, Menchie and Bernice and I were saying we were going to do 45 minutes, followed by 50 minutes of questions. I've run over. We've done 46 minutes. But we'll now start working through some questions. I've got up here some frequently asked questions that people may have that are more about the product itself. But yeah, Menchie, do you want to start kind of working through, help us to work through some of these questions?
Yeah, sure. We can come with the first questions, like the downtime of this
Yep.
treatment.
Yeah, we covered that one. We covered what is the downtime.
Safe for breastfeeding.
Yeah, safe for pregnant and breastfeeding women. Yeah, that is a very common question. All of our products are safe for pregnant and breastfeeding women, which is great.
Is there any halal certificate or is it halal for this product?
It is not halal certified, but it is a product that is still fine to use, but it is not. We haven't got a halal certification specifically, but it is safe to use.
Okay. So do you recommend to use
Sorry,
any?
Mom.
Do you recommend to use any topical anesthetic on scalp block prior to the kneading session? Because I think there are a few questions asking the same. The patients complains about the pain for
Yeah,
the kneading treatment.
no, I get that. I get that. So I'll give you a bit of context on the answer to this question. We were kind of like, yeah, if you wanted to, then you could use topical anesthetic. And then I had a doctor in the UK, no, in the US, that had been using the product and getting really good results. And she had maybe about 15 or 20 success stories. And then she said a few of them were complaining about it kind of being uncomfortable. And so she said, can I use a topical anesthetic? And I said, yeah, okay. She then, for her next 10 clients that she used it on, got 0 results. So we don't actually recommend to apply topical anesthetic because it can actually impact the product. What I would recommend is this. I'd recommend if you've got an adjustable microneedling tool, we have actually noticed you do not need to go really that deep to get the best results. Some of those before and afters I just showed you, some of them are actually going at 0.5. So what I would suggest is I would suggest start at 0.5 mm and then I would just try and work your way up through the adjustable setting and just ask them their comfort level. If you can get it into that 0.8 to 1.2 range, that's the ideal setting. But what our research and studies have actually shown, it doesn't really make a difference whether you go 1.8, 2 millimeters or 2 millimeters, or whether you go 0.8, 0.5. Once you get to 0.5, it starts to get a little bit more mixed, but if you can get it up to that 0.8, 1.2, that's actually where all of our before and afters sit within that range. When you get into 2 mm and above, it just gets quite painful.
How about scalp block? No, only also do not recommend.
No,
Okay.
I wouldn't recommend that. Same reasoning, same answer.
Okay. So I think the go deeper at 2 mm just answer as well.
Yeah.
Okay. May I know if hair shedding is expected while still undergoing the treatment cycle?
Yeah, good question. That's a common question because of minoxidil. That is something that happens with minoxidil. No, that doesn't happen when you go through using this product. What I will say is this: if you have clients that are already on like minoxidil or finasteride, they're already using certain hair loss treatment products. Don't take them off it and then put them onto the advanced hair system, because what can happen is that if you take them off it, there's a shedding phase that happens, and then you introduce the advanced hair system, and then they associate the shedding with the advanced hair system, not with the fact that when you come off minoxidil finasteride, there is a shedding phase. But no, during the advanced hair system service treatment cycle, there wouldn't be expected shedding. What there might be is, because of the increased cell turnover, you might get a little bit of what appears to be dandruff, but it's just the removal of dead skin cells, basically. That only happens for a little bit, and at week 2, maybe 3, and it's very rare that that happens.
Okay. Move on to the next questions. Once open, how soon to finish, and what's the storage
Yeah.
method
Yeah.
after opening?
What's the storage? Yeah, so there's a couple of things to add. Number one, you'll see on the screen it says, "Why is it pink?" So the reason it's pink is because it's a pH indicator. Okay. Now you do not need to store it in a fridge. I recently moved into this flat a couple of months ago. This is where I do all of my calls. I do a lot of calls here in the evening, and so I store all of my products here. I'm in Singapore, the sun comes in. Room temperature is absolutely fine. Once opened, I do think it's best to maybe keep it in the fridge just to reduce the risk of contamination. And it also feels nicer, right? It feels nicer putting something that's cool onto your scalp versus something that's warm, that's room temperature. But there's no necessary requirement to keep it in a fridge or anything like that. It's just to help reduce the risk of contamination. You will know it's been contaminated and not safe to use if it changes from this kind of reddish pink color to like a yellow brown color, then it's been contaminated. You're on mute, Menchie.
So then another question is that if a patient tries this for 3 months but experience more hair shedding, so should she continue?
If they've been trying it for 3 months and they've done the product with the exact protocol that we've gone through, where they've done a 12-week program once per week using a whole vial in the clinic, controlled by you, and they experience more shedding, I'll be honest, that would be a first that we would see that. If they continue to see that, I'd be honest, I'd probably then be like, right, we need to figure out really what's going on, do a blood test. There must be some underlying thing going on here. The products have, you saw in the clinical data, that it's got a 94% success rate. So it's got a very high success rate. There are instances where it doesn't work. It's kind of ironic. Our chief scientific officer, Professor Fun, it doesn't work on him, which is kind of ironic because he's the guy that created the technology, and he deals with hair loss. So yeah, if that happens, I would probably say that they may need to look at an alternative treatment, but I would also probably say that is unlikely to get that result.
Okay. Can we use stem and CALECIM's advanced hair, or only the CALECIM advanced hair for patient immediately after the hair transplant, because the patient's scalp is damaged and very sensitive?
Can we use something only has it for patient immediate? So yeah, so immediately after hair transplant, I would actually what I would do is I wouldn't use the any needling tool or anything like that after the hair transplant. For after a hair transplant, you can use the one vial, apply half of the vial to the donor area and half a vial to the implant area. The half the vial to the donor area will accelerate the recovery, reduce scarring, and hopefully help regrow what we've got in there. The other half will then actually hopefully help enhance the results of the hair transplant. The usage of the advanced hair system with hair transplant is more within maintenance. It's more within once the hair follicle starts sprouting at month kind of 3-ish, 4-ish, then we can be like, right, okay, now we'll start using the advanced hair system to enhance the results, exaggerate the results.
What's the difference between the CALECIM hair and face serum?
The difference between the difference between the face serum and the hair serum is pretty simple. It comes down to the pH level. So the pH level is a little bit more conducive for the scalp for the advanced hair system. So therefore we've just kind of lowered it a little bit in terms of pH. We also have the fact that the formulation, sorry, I've had a long day. The formulation of PTT6, it contains a few different other elements and growth factors that are more conducive for hairy growth. You saw some of them up there earlier, like vascular endothelial growth factors, fibroblast growth factors, and things transforming growth factor that basically help to basically exaggerate the results, whether it's for hair or for skin, essentially. Oh, sorry, you're on mute at the moment, Benshi.
Sorry. So a participant asked, the before and after photo session is your presentations, are they purely on this CALECIM microneedling treatment, or they're also on oral medication?
No, they're all of our before and afters are all exclusively on the advanced hair system.
Okay. What's the storage temperature? I think we answered this.
Yeah.
Does it help with gray and white hair?
Yeah, we spoke a little bit about that,
Yeah.
right? We can't explain that, but it does sometimes help with that.
If the
Is it
same,
for kids? Is it suitable for kids? The next question is advanced hair system suitable for kids?
Oh, is it for, sorry. Is it suitable for kids? I mean, if I'm honest, right? If you've got hair loss and you're under the age of 18, you probably need to figure out what's going on there, because there's some underlying condition probably that's impacting that. You want to do a blood work, you want to figure out what's going on. It's not suitable for kids, I'll say that. All I would say is the advanced hair system on its own, I think you would want to look at some other things to do a little bit of a combination therapy. With that, I think you want to look at vitamin deficiency, iron deficiency, thyroid functionality. There's a few other elements that I think you want to look into that can exaggerate those results. So it's not bad for kids. It's just if kids need it, then we need to probably look at a multi-therapy treatment program.
okay, if the same MSC used for culture expansion for 30 cycles.
Yeah, will the quality of growth factors be affected? No. So when we say that it can passage 30 times, it's passaging 30 times. We know after 30, that's when it starts to decline. The quality starts to decline at that point. So that's where we figured that out, essentially.
Okay. The interval between treatment, I think, answered in the presentation will be.
Yeah, depends really. You just need to check in and kind of figure out, I talk about this a lot actually, which I didn't mention. There is a difference between what you would call situational hair loss and gradual hair loss. If somebody has hair loss that's a situational context, like stress, a traumatic experience, then they might be less inclined to need it over a long term. Whereas if somebody has inherent, hereditary hair loss, they might need to be more consistent on it. So it's going to be case by case for that.
Is there any FDA approval?
So FDA approved as a cosmetic product.
I think I can answer this. Okay. When was the technology started? 2016 or 2020?
No, so the technology PTT6 in the origin of it was actually 2004, was originally when this technology came about. Now that was when it was being used for medical research. CALECIM started in 2016. The advanced hair system was created in 2021. So cell research founded 2002, technology created in 2004, CALECIM started in 2016, advanced hair system created in 2021.
Okay.
These are great questions, guys.
Okay, I think this one also answer
Yeah.
it work conjunction with post hair transplant patients.
Yeah.
Maybe next questions. I think it's a similar question. So what's different CALECIM skin line versus hair range? How do you make it different? Maybe we can elaborate more on how we make it different.
Yeah, so there's just key growth factors that we just identified, and so we just highlight those. You can identify and basically figure out key growth factors that are suitable for skin, suitable for hair, and then you can exaggerate whichever ones that are going to be best suited for that. So, for example, in the professional pigment solution that we have, our professional pigment solution product, what's a good example for that? Fibroblast growth factors are really beneficial because they enhance the skin repair process, which reduce the risk of pigmentation. So you can do that for a variety of products, essentially. But that is how we do it.
Can we use in conjunction with minoxidil?
You can. I would just recommend doing topical minoxidil on a different day.
I think there's one candidate, they want to reconfirm conditions that not respond to this product: scarring, cancer patients, alopecia areata, high-grade hair loss, and Norwood grading.
So just the only one I take out, alopecia areata. It works for alopecia areata. So it works for scar. It doesn't work for scarring alopecia, cancer treatment patients, and hair loss that is too far gone. Alopecia areata is fine.
I think for oral supplements, Norcrin and CALECIMs, I think Ross is not able to answer this question. Maybe doctors, you can actually contact our sales representative to give you this protocol. All right.
Which one? Sorry.
The use of Norcrins and CALECIMs.
Okay, no problem.
Yeah. What's the initial length of microneedling that we should start with? I think it's 0.5. Am I right?
Yeah. Start with 0.5.
Bernice, maybe can help me to have
No, it's all good.
time to look
We're
through
nearly
this
there.
question. Can patients use CALECIM Professional Serum for the hair loss treatment area instead of using the advanced hair system?
You could if you wanted to. Theoretically, it wouldn't necessarily have any negative impacts, but the advanced hair system is more suited for hair. The pH level is just a little bit lower, so you're looking at around about kind of 6.5 versus the pink serum is about 7.5 on the pH level. So it basically creates a more conducive condition and setting for the advanced hair system to work in a more efficient and effective way. Look, that being said, could you use the professional serum and would you potentially get results? Yes, of course. But it's better suited to use the advanced hair system.
Okay, is this a secret terms or condition medium?
Well, it's an interesting question, secretome or conditioned media, because the secretome it's a little bit of both, but it's primarily a conditioned medium.
Okay. Can we use 2 valves at one go for better
No,
result?
you can, but it won't enhance the results per se. It won't exaggerate the results necessarily. Just by using more, it wouldn't necessarily exaggerate it. No.
Okay. Does this help with TE? Yes, all types of hair loss.
Yeah.
Can you explain more about the pH between the CALECIM hair and serum?
Yeah, but that was what we just went through. Yeah, it's just a little bit different. The serum is a little bit higher, and then the advanced hair system is a little bit lower. So it's kind of about 7.5, and then the advanced hair system is about 6.5.
Okay. Does it work with the GLP related hair loss?
Yeah, it does. Yeah, absolutely. It's very, very common, right? GLP, weight loss drugs, for sure. It definitely does work for that. It works for COVID-related hair loss, stress-related hair loss, weight loss drug-related hair loss, all of those. The answer always, if you're thinking, does it work for this, is yes, unless it's cancer, scarring alopecia, or hair loss that is too far gone.
Yeah, I think we have the last question from the floor. Do you advise for LLT laser red light therapy post-treatment? Do you encourage to take minoxidil post-treatment?
Yeah, I think I would probably I would probably say when it comes to minoxidil, that's fine. Just do it on a different day. For red light therapy, absolutely fine. Do 20-30 minutes afterwards. Same with low level light therapy, laser. All absolutely fine. So the answer is basically yes. So I wouldn't encourage them to take minoxidil necessarily because the product works much better than minoxidil based on the data that we have. Minoxidil has a 50-60% success rate. Remember the car analogy I mentioned earlier. Minoxidil is just putting more fuel in the broken car. The advanced hair system is actually bringing the car back to the garage and replacing all of the parts to make it like the car was when it was brand new. So you can, you don't have to because the product works well enough on its own.
Will facial hair or brows will respond to the product?
Yeah, so yeah, that's actually something that we have seen very, very often. People using it for facial and hair brows. So yeah, we are seeing some really amazing results for people doing that. The only thing I would just say for eyebrow is that you do need to just be careful because it's quite runny. It's water based, not oil based. So therefore, you do need to be careful. So you just want to make sure to lay back when you do it. But yeah, it works for both facial and hair.
Okay, I think we do not have more questions from the floor, and I think it's past 9 already. I think, yeah. So thank you, Ross, and everyone for this insightful presentation. And again, thanks again all the doctors to join this session afterward. So now we will adjourn this webinar, and if you have any more questions, feel free to contact your respective sales representative in your country, and then if there's any updates, we will update you. So thank you so much, Ross and everyone.
Thank you so much, guys. Thanks for the great questions. Have a great rest of the week.
Okay, good night, everyone. Bye bye.
Thanks, guys. Bye.